not a good look for our profession.
How in the name of common sense did this ever get this far? Vaccines are not seek and destroy missions.
Because he was so severe.
This is nuts.
One of the top 20 things that she has discovered with her research company, Progenobiome, medicine has been corrupted. Where we go from here now, I don't know. Well, it doesn't work.
So angry, punishable with jail time.
Literally, this makes me believe we live in the Matrix. Like,
Deadliest year in U.S. history.
It wasn't a question of if, but when.
First red.
if it doesn't work and it's safe, put it in a little Fauci Pez dispenser, give it to the patient, and shut the family up.
It's going to get worse and worse and worse.
Gave Fauci an award for being a hero of the pandemic.
This has been a problem.
These were lies.
Let's talk about the healthcare professionals supporting this.
In the meantime, what was going on behind the scenes?
Irony of the whole thing is,
Harvey's 100% correct.
This is freaking annoying.
ultimately we need to have hope for America.
What is going on here? What has poisoned your mind? Buckle up, kids. Welcome back to BS Free MD. We're doing a Just May and I episode, something I've been really thinking about a lot. I've written about it. It's been on our Substack, on our mailer, and really it's how to save healthcare. You notice I didn't say how to save the U.S. healthcare system or how to save healthcare in Belize. It's how to save healthcare, period, end of story. And some of the stuff I say may be interpreted as offensive. For that, I am 100% unapologetically not apologizing, because I think we have to get to a reality-based system based on the realities of health, the realities of money, and the realities of the dipshits that we put in power over us. In other words, the rule makers and regulators. And we do it all backwards. What we've always done is we've always gone to the rules guys and assumed that they're going to make rules that are somehow going to make us healthy or make healthcare equitable or make it cheap. And it hasn't done that at all. If anything, the ACA has made healthcare wildly more expensive and unavailable for people compared to what it was before, all in the name of trying to get things there.
Why don't you explain what the ACA is?
The Affordable Care Act, otherwise known as Obamacare.
There you go.
It was clearly a big payout to insurance companies and pharma. We could do 10 shows on how all that works. We won't. We're going to try to do this in half an hour or less, believe it or not. And there's 3 things you need to understand if we're going to radically change healthcare for the better. Number 1, we have to understand personal maintenance. Number 2, we have to change how money is spent in healthcare. And number 3, we need rational legislative and regulatory changes, as well as leveraging technology. So let's start out with the first one. Jesus was right. Only the sick need a doctor. If you are never sick, you never need to go to the hospital. You need exactly 0 health insurance or 0 money saved for healthcare. Why? You don't require it because you're not sick.
Now, people are going to say, but wait a minute. What about things you can't, emergency things that you can't prevent, like your appendix rupturing, a pneumonia that you catch, a cancer that happens? Those are all across the board as far as cost. So
correct. But exactly. And that's when health insurance was actually insurance. Okay, let's just take a little side road here, explain what insurance is. Insurance is a financial vehicle to save you from a financial problem that you cannot financially help yourself. So let's assume you have a $900,000 house and you are up to date on your insurance payments, and your house, unfortunately, I'm going to say my acquaintance, Mel Gibson, it burns to the ground. You fight a bit with the insurance company and they give you $900,000 for your house. And then whatever your contract for your contents, they pay it out. It's insurance. You never want to use it because it's not ever really worth it, but at least it saves you from a $900,000 hit to your net worth that most people could never, ever recover from. That's actually insurance. insurance is a financial vehicle. Health insurance in the United States, first of all, has basically zero to do with health, and it's absolutely 100% not insurance.
No, it's a
Okay. If you had sick care insurance, okay, so it didn't cover chronic illness, it didn't cover type 2 diabetics, it didn't cover hypertension, it didn't cover the results of obesity, whatever. And all it covered was heart attacks, cancer, pneumonia, ruptured appendix, like I had, all of these things, then you could have real insurance because most people are at risk for those things other than heart disease. But assuming an appendicitis, everyone is at the same risk for that. So you risk pool that money. And then when you get the $25,000 or $50,000 bill or whatever for the surgery, it just comes out of your insurance and your premiums would be really low because we'd only be insuring things that happened rarely that really needed to be covered that most people wouldn't want to cover by writing a check. Okay. So that's insurance. And if you're healthy, but that's not the problem is chronic illness is what's killing the entire system. We're paying for all these people because of morbid obesity, because they're type 2 diabetics or metabolic disasters, which causes hypertension and heart attacks and then COPD from smoking. These are all behavioral related illnesses that cost a ton of money.
Yeah, and you know what? I got to jump in. What really makes it sick to my stomach, though, is you see all these commercials on TV. You see these other physicians that are obviously bought up by pharma jumping in and saying, you can't help it. Your type 2 diabetes is genetic, and therefore that responsibility is off of you. And I think people now want to go, I want to blame the food because it's crappy quality. I want to blame the plastics in the water. I want to blame all this other stuff. It's not, I can't control anything. Therefore, it's not my responsibility. And I see a lot of that happening. That's the big push.
Yeah,
Subtly,
no,
don't you think so?
No, yeah, it's a canard though. It's
No, I
entire
know, I'm just
horseshit.
saying that
Like
people
even
want
the
it
red,
off the
right?
responsibility.
But even the Callie and Casey means and the red eye, and they're poisoning us with your food. Okay, yeah, but you know what? Most of that food
You don't
is
need to eat
poison,
it.
and you don't need to eat it. Okay, like when there's a clinic I work at that has a Walgreens damn near in the parking lot. Last time I checked, I have 100% control over whether I go in there and buy nicotine patches, a Red Bull, and Cheetos.
Red Cheetos.
Okay, so red dye number, I'm going to give you cancer of the penis is in the Red Bull. At least I assume it is, because I don't think that watermelon red color is actually watermelon. And, the Cheeto orange number.
But you know what?
Whatever.
This is where we can go on tangents forever, because then the argument I've heard maybe from them and others is that, but a lot of people aren't educated well enough and don't have access to food, and you're living in an impoverished area.
Okay, you know what?
You know what I mean?
Okay.
There's always blame.
Yeah, good. I don't give a shit. Honestly, I don't.
I'm just
You have to own yourself. You're going to own it anyways. And I get it. I do get it. We have worked in some of the most impoverished areas in the entire country and some of the most impoverished areas in the entire world. I get it. And actually, third world mountain people in the Philippines ate way better than the morbidly obese people on the Oregon Trail card in rural Oregon.
But
because they were forced to grow their own rice and kill their own chickens.
Yeah, but to their point, this is when I'll let you get into the government regulations. If the U.S. got rid of a bunch of this shit that they're allowed to put in the food in the U.S. that they don't have in these countries in Europe and overseas, red dye and all this Cheetos and pop in the dispensers in schools, etc., then you could eat natural food.
Yeah, no, I agree. I'm not saying that you shouldn't do that. I'm just saying,
that some of these third world countries have actually healthier food because they don't have all the shit that we make in the U.S. that's processed.
I'm not saying that stuff's not important. I'm just really nervous that the way Maha is going now, we're majoring in very minor points. I don't think red dye number 6 or whatever it is why people are morbidly obese and choking on their own fat and need a CPAP machine.
Big picture,
I don't think
right?
that's
Big
why.
picture. Try to take responsibility for your health and do the best you can.
Like we had soda in the 70s and we almost never drank it. And my parents were upper middle class. You could have drank as much soda as we wanted. We had it like a couple times a month, maybe, because they knew it was crap.
Yeah.
It's all sugar. It's absolutely has to be garbage.
How have we gone from, you're right, our upbringing when we knew that was just garbage, and cereal, same thing. We could occasionally allow to cook some Fruit Loops, and now people just assume it's a staple.
Right. So
anyway.
number one, take care of yourself, maintain your health. It is possible. Okay. I get it. Some people are born with crappy diseases. Some people have things that are out of their control. Don't worry. If the people that truly controlled what they could control and got fit and got healthy, there'd be way more than enough money left over to take care of all of these other unfortunate people that are born with congenital maladies or bad diseases that just happen for reasons we can't explain. So I'm not going to listen to what about little Johnny? Honestly, I don't care about little John. I care about constructing a system that works the best for the most people. And then we'll have so much money left over, we can deal with all the little Johnny problems.
Yeah.
So we don't worry about that right now. So take care of yourself. If you're as healthy as you possibly can be, absolutely 100%, you will consume less healthcare. Number one. Number two, money. Okay. We have to break the spell. If we have to take fire trucks filled with holy water and spray people down so they're done with this completely satanic message in their head that they can't get any care unless they have insurance, that is completely nuts. Look at how much money you are spending on health insurance and how much your employer is spending. That's just money. We can do it way cheaper. If every hospital system and every visit you had at the doctor was cash, you would get way better service for a fraction of the cost. We know the second we're done with this podcast, we are driving to a cash clinic and pulling out credit cards so we can sit with the guy for an hour and a half going through our healthcare concerns for $150,
which is less than my copay on my insurance to the doctor's office for 15 minutes.
That's where an urgent care visit starts in most places in the United States before testing, before a chest x-ray. And if you're lucky, you're going to get 6.25 minutes with that physician.
We're on a high deductible healthcare plan with one of the biggest insurers in the country. And $200 is my copay for a 15-minute visit.
Get fit, pay cash. Money is power. If you bitch and moan about how much power health insurance companies have over you, and they're not allowing you to get the test you want, and they're not allowing you to get an MRI, don't give them your money because you're giving them power. That's the way it works.
And start researching other options. There's stuff out there people aren't aware. Medishare has been around for a long time. Crowd Health was on our podcast show and is an amazing revolutionary.
I'm about 5 minutes away from getting a Crowd Health tattoo. I love those guys so much. There's ways to structure this where you can pool, where fit people can pool money. In Crowd Health, you can't be obese and you can't smoke. Well, guess what? If every single person in the country, if you want to get back at insurance companies, if every single person in the country that was fit and not a smoker joined something like Crowd Health, you would bankrupt the health insurance industry. Because here's the dirty secret about how payment works. Okay? People are like, what if I'm obese? I can't help it, or whatever. What? I don't care. The reason I don't care is I've been paying. I consume maybe on an average year, $400 of healthcare a year. Okay. And we're spending with our health savings account and my insurance, we are personally spending about 20 grand a year. Okay. What does that mean? That means I'm subsidizing very unfit people with very bad lifestyle-based illness. Yeah, I get it. Every once in a while, somebody gets a rare cancer for no reason. But largely what I'm doing is I'm subsidizing to the tune of $19,600 a year people that can't take care of themselves. I'm done.
And as we talked about on Crowd Health, I'm just going to throw that out there and not selling it. But you can have all that kind of coverage for $250 to $350 a month and have all the disaster coverage.
Yes, because guess what?
Cheaper.
If you're super fit and not a smoker, all you need is disaster coverage. You get in a car wreck, the car insurance company takes care of it. You get run over, buy a pool contractor like me and they destroy your bike. Their insurance buys you a new bike. You don't cleanse the demon out of your mind that you can't get care without insurance.
And I
It's
was
unbelievable how much better and cheaper your care will be if you find a way to pool cash resources.
And the-
Tattoo this on your mind.
The other thing that's happening is your money, what you're paying and you're not utilizing, is not just going to fund other unhealthy people. It's going into the pockets of the insurance companies and all of their
Yeah.
beneficiaries. And the more they get, the more they want. And they keep raising the rates so that they can get more. So we got to stop that.
No, yeah. But again, right? People are like, what about this guy? And he can't help it and whatever. And it's just like,
Those are
again,
the ends of the bell curve.
and I also don't care because I'm done subsidizing people that don't look. Like I've run 12 marathons. I could lose some weight. I know how hard it is to lose weight. I know what it's like to be fat. I know what it's like to be skinny. I know what it's like to be sober. I know what it's like to drink too much. Guess what? I've tried it all out. And I can tell you that fit and thin is way better. And it's also really hard. It's the second hardest thing in the world to being fat and lazy, because that's the worst thing in the world. So let's put all this bullshit aside and recognize healthy people. You're paying for all the fat guys at 7-Eleven when it comes to healthcare. Sorry, you are. Oh, that sounds so hard. You're a doctor. You should be compassionate. I'm the most compassionate guy in the world. Because if I wasn't compassionate, I tell you to eat more Mars bars and drink more soda. And who gives a shit? Be fat and happy and take your metformin. But you know what? That's a crappy life. And I think people should live better than that. That is a compassionate statement. I would expect so much more from my kids, and I have, and we have been successful in that because that's what we demonstrated to them. And I have said this to patients, almost this tone of voice, and some of them get it, and they come back weeping because they never knew what they were missing out. So don't give me this. I'm done enabling people to have bad lives. And that's what we've been. So there you go. So there, get fit, pay cash. Lastly, and this will be short, effective rule changes. This is where the government has got regulation has got everything completely wrong because the government cares about money. And because the only thing they can do is make laws, is they make a whole bunch more stupid laws and regulations that cost people a whole bunch more money, which then entrenches their power because money is power. And if they control where money is spent, because lobbyists from pharma and hospital systems and God knows who insurance companies come to them and say, pass this law that we wrote, because this law will make sure that you get an extra $10 million for your reelection to entrench your power. And it'll entrench our power because it'll cost people more money. Guess what happens? So just you got to get rid of so much regulation. Okay. And the biggest thing that I would do, and people are going to lose their minds over this, the biggest thing that I would do is I would make primary care uninsurable. What about preventive maintenance? If you prevent it, nope. If it was uninsurable and cost effective,
I think there's some things
and
that
really
should be
cheap,
covered, some basic stuff.
I don't know. I'm to
That
the
is-
point. I'm to the point. It's such
I
a rat
disagree.
race.
I think the mammography, the colon cancer screening, a couple other things.
Yeah, you could do that. You could do some screening, but
Yeah.
you don't need a doctor to tell you
No.
the colonoscopy. You need an app to tell you.
Right. Exactly.
And that's the other thing. So when it comes to apps, absolutely 100% leverage AI. People are like, hey, Sean Baker did a big post about pull your head out of your ass, doctors. AI's coming. No, Sean, I'm sorry. AI is here. Just like that gigantic T-bone that you're going to eat in 5 minutes, AI is already here. So the idea that we're going to legislate our way out of AI is insane. We should embrace it.
Mm-hmm.
We should use it. We should get ahead of the curve. We should use AI in a way that's helpful. And I'll give you an example. When I go to work and I see 40 patients a day in urgent care with respiratory viruses, most of that medicine is algorithmic. Do they have a fever? Do they have a sound in their lungs that looks like pneumonia?
How long?
Hypoxic. How long have they been sick? Blah, blah,
Right.
blah, blah, blah. Okay. Guess what? An algorithm can do that better than me in about a billionth of a second. So you don't need me. Get rid of me.
It takes out the emotion. It takes out
Yes.
the
Go to
subjectiveness.
there are tests. There is a
Uh-huh.
test by a company called Health Tracks RX with a nasal swab like a COVID swab. And it gives you COVID. It gives you like 5 or 6 different respiratory viruses. It gives you not pneumococcus, the other one,
Flu, RSV.
mycoplasma.
Oh, yes.
So it gives you here's a virus that you can treat, flu. Here's mycoplasma, which is an atypical bacteria that you can treat with Citromax, and it differentiates. Okay, you got rhinovirus. Sorry, you got a cold. Nothing we can do about it. You could literally walk into the little robot room in CVS, and a little robot hand would, put your chin on the thing, swab you, and in 24 hours, or if you do the test, blow these tests up, maybe in 6 hours, you know exactly whether you need antibiotics or not, and you're done. That's it. No more urgent cares. Like, deal with all of this acute illness. Urgent care sees people that fall off and break
just
their
thinking,
legs.
Go up to a dispensary, put your urine sample in for a UTI, analyzes the urine,
You don't
spits out.
But you know what? With the appropriate AI, large language model, most women with a UTI would not need any urine sample.
No,
Because it's like, how old are you?
we don't have to get into the details, but there's a way to differentiate. It's going to be positive.
If you're over 70, you need to give a urine sample. If you're under, so leverage AI, deregulate the hell out of this stuff. I would want at least 90% of primary care cash paid, because then it would be very competitive. The price would go down, access would go up like crazy, and you'd basically be seeing patients for the copay anyways. And all the poor doctors dealing with all this bullshit from health insurance would go away. You don't need a billing department. You don't need any of that. Okay. And then the last thing, and then we'll tie this up. And this sounds really bad for all my free market people. I would damn near socialize expensive stuff. Hospital medicine, like when you come in and you have a trauma, or you need a surgery, or you have back pain that might need a surgery, those surgeons are paid very well at a market wage, but they're not financially incentivized to do more surgery. They're financially incentivized to do the right surgery.
Now,
That is easy to say, hard to implement, but you can't. We do 10 or 20 times the spine surgeries as they do in the UK. And that's been a fact for decades. That might be right. It might be wrong. I don't really know.
that's a tough one for me,
But we gotta
because
be
I
careful
think you
with
got to
that.
start there, but yet then how do you decide who's doing good care, good surgeries versus
Right. Because,
paying everyone the same when the quality's not the same? You have to have a way to.
and it's a rabbit hole.
Right,
It's a
exactly.
rabbit hole, because sometimes the surgeons that do the most surgeries and make the most money get the hardest cases.
Yes.
And so they're fixing everybody else's screw ups.
Mhm.
I get it. It's complicated, but
But that's a starting point.
there's
Yeah.
there's got to be a starting.
I-
And then maybe it's seniority. Medicine is really insane in this regard. If you're a nurse and you have exactly 0 days of experience, you're on the bottom of the totem pole. You don't make the same amount of money as a nurse with 30 years experience. You don't get the same schedule. You don't get to work in the same areas of the hospital. If you are a physician, newly minted, just pooped out of the healthcare system, straight into a practice, you make exactly the same amount of money in most cases, not in all, but in most places, as a guy with 35 years experience. I'm sorry, that's nuts. So if you're a surgeon that does the hard cases and you've worked your way up, just like if you're, I don't know, who else has a lot of responsibility for a whole bunch of people? Pilots. Do you think the pilot with 800 hours makes the same amount of money as the pilot with 35,000 hours? No. Do you know why? Because they shouldn't. So look at that.
I like that. It's succinctly in a half an hour, you summed up how to solve the U.S. health,
Not the system.
No.
How to save health.
how to
US
save
healthcare.
healthcare.
Because in Canada,
I think you should work with RFK Jr.
I'd love to. I would love to work with RFK Jr.
We'll have
He'll
to-
get my abs absolutely six pack, and then we'll go out falconing, watching birds kill little roadside creatures. Cool.
We'll send this episode to his assistant, our friend, and see.
Yeah.
See if you can get you a job.
No, but like, you have to do this. You have to get fit. You have to take care of yourself. You need to be motivated to do that. You got to pay cash as much as possible. And we got to leverage AI technologies because it's already here. So we're going to have to deal with it anyways, and change regulations. Like this business of you go to a doctor with a hangnail, you're super healthy, you got the hangnail because you were in a CrossFit competition, and they ask you, do you feel safe at home? How many beers do you drink? Do you masturbate with your right or left hand, or what? All this completely insane crap, which I encourage people to lie about, because really they're harvesting that data. And if it goes into a system, a major EMR system, the government's harvesting that data. Whoopsie. Sorry, that's how it works.
You want to mess with their AI.
Yes, because I never drink and my wife terrifies me. So dumb. Anyways,
I love it.
it was fun.
You did a great job. And after ranting at your thoughts at home at me, it was time for you to share that to the general public and get that out there. So I'm glad I gave you this opportunity to share that on the podcast. And we hope you share this with someone else you know that thinks likewise or needs to be enlightened. And as always, we try to keep it BS free, bringing you our thoughts and really interesting guests. See you next time.